Welcome back to another Front Office Rocks YouTube exclusive video. I'm Laura from Front Office Rocks, and I have Colleen Huff here. Colleen, welcome to another YouTube video. Tell everybody,
Thanks,
if they
Laura.
haven't watched you yet, tell us a little bit about your background before we get into our really fun topic of this video.
Okay, so my history is a little different than a lot of people's. I started at an insurance company. I got trained in a classroom setting with MetLife. Was getting paid to talk on the phone, which according to my husband was the best thing ever. He thought he should be paying MetLife. And I loved my job. I had my little cubicle. I was happy. I loved what I was doing, and we got transferred. And I had to take all this knowledge and do something with it that I couldn't go back to an insurance company due to a non-compete clause for a year, and I ended up in the offices themselves. And as I like to say, that's when I discovered how little training anyone is getting who's in the offices. And over the years and thanks to you, have figured out ways to help educate others so that they're not doing it wrong, and to help them understand it to make life easier for them and more accurate insurance breakdowns. And I love it. I know it's not your favorite thing in the world. I think it's great fun. It's a little bit of a mystery for me to solve. So that's what I enjoy.
Well, and that's kind of the topic of this discussion. So I jokingly say I don't like insurance, but I actually love insurance, meaning I love understanding it. It's like you said, it's like a mystery. It's a puzzle. And when I can make a patient's account balance and I know exactly why, I love that. But one of the reasons I don't go that way is because I also love running a dental office and the schedule and the phones and all of that. And when you're doing both, it's hard to do. So that's really what I want to talk about today. The importance of the insurance person in your office, how detail oriented they need to be, and then how we make them successful. So Colleen, do you want to talk a little bit about what you've seen or how you do it? Because you run an office currently and have to do insurance. So talk to me a little bit about that.
I do. One of the keys to a successful insurance coordinator is giving them that time away from the phones and away from the chaos and away from the patients, because most of us that end up in these roles, we are people, we like to be with people. We like to have that time. But when you're dealing with the insurances, whether you're getting a breakdown or you're entering in a payment or you're figuring out an account, you don't need to be interrupted. And it's those interruptions that cause the mistakes to happen. It's the interruptions that make you miss a little piece that makes it covered or not covered. And it also makes the stress level goes up, and you keep, it takes, what is it, an average of 5 to 7 minutes for a person to get back on target when they've been interrupted. So imagine that all day long, you're not getting anything done. So one of the things I do with my front desk person, we take turns that we go in the office and we ignore everybody. So we have a small office space. It's not huge, but it's enough. And we go in there and we shut the door. And the deal is, if there's 2 patients waiting for checkout, they act like I'm not there, or they act like she's not there. There are times you're alone at the front desk, but you have to train your team that too, because they're going to go knock on the door and pull that person out. A patient can wait. They wait in the reception area for the doctor to seat them. They can wait 5 minutes or 3 minutes for checkout. And so it's a mindset. There's for some reason, a mindset in an office that when the person first comes in the door, a 1 or 2 minute wait while a room's getting ready is okay. But when they leave, the front's supposed to be instantly ready for them. And I don't know why. And we have to change that mindset sometimes and give them that privacy and peace of mind time.
Well, a lot of that is like weighing the importance. So like if you're doing something important like insurance, is to get pulled out to check a patient out. If your team can be trained how to handle 2 patients and what they say, just like answering the phone's ringing, a patient's in front of you, you need to train your team on it. But there needs to be some discipline when it comes around insurances, because like you said, that's where mistakes happen. And the number 1 complaint on the internet about dental offices has to do with the front office. And most of those complaints have to do with estimates and insurance. And so if we stress our insurance people out and don't let them focus, we don't put the estimates in correctly, we don't let them figure out the balances correctly, in the long run, patients are unhappy, and that's what we're trying to avoid. So you and I were talking before we started this video that we're seeing a trend of outsourcing insurance, and we're not advocating you do or don't. I did in my practice. The last 2 years I was there, we outsourced it, and I can tell you the multiple reasons why. Are you seeing that kind of happening across country, and what do you think the reasons are, or the pros and cons of doing that?
Yeah, I'm seeing it as a big trend. I don't know if you're seeing this, but I'm noticing a lot of companies that are springing up It seems to be a trend for those of us that have done it. Some people are going out and starting their own companies. And I think a lot of it is because if you're at home and that's your whole job, you're not getting interrupted. They're not pulling you for different things. I did have another person give me the thought process for the offices. It's less on the doctors, less payroll, less employee time off. They're not worrying about all of those extras that happen as an employee, and they're also not worrying about replacing them if they walk out the door, because even if that person leaves with the company replaces them with someone else. So I think it is going to become more and more common, because it's allowing that job to be what it's supposed to be, which is that's their focus, as opposed to I'm an insurance coordinator, I'm answering the phones, I'm a scheduler, I'm checking in, I'm checking out, I'm seating a patient because the back's busy. I mean, there's so much that happens to the front desk. You know, we got 12 hats going at the same time, which anyone who's done it knows. And yes, we sometimes thrive on that, and that's why we're good in those positions. But that insurance part, we have to make ourselves step away from the chaos.
Yep, exactly. And so the thing I would think is that if you're, I mean, we've been speaking to the doctors or anybody watching this in the dental industry, but if you're an insurance coordinator, and you're good at this, you got to stay good. You've got to stay up to speed on insurances. You've got to set yourself out of the everyday craziness. I mean, it's great. We're all proud. I actually have seen speakers talk about this. I'm all proud about multitasking. But when you multitask, you don't do anything super great. Right. And with insurances, we want it to be done super great. So talk a little bit about how to stay abreast of insurance, how to keep up with the latest and greatest, because that's an issue too. I think people have always done it the way they've always done it, but we've got to be growing and learning.
It's a constant. I have used, I attend Teresa Duncan's seminars, and I also speak, so you can attend my seminars. There's a number of us in the industry that will help each other out with the different things that we're seeing. I use Google Alerts to stay up on different things happening in my area. Alert for certain insurance companies in our area, so you may want to look into that. Charles Blair's information is always great. He's got an insurance newsletter that he does. Yes, there's a cost to it, and some doctors don't want to do that, but there's ways to do it. NEA does webinars, ADOM does webinars, and there's any of the industry magazines that are out there. There's almost always an insurance article of some sort, and so I'm constantly reading and I'm learning something. I tell everybody, I seriously learn something new at least once a week, if not daily. And I do this is what I'm looking for it, but even without looking for it, it comes across your desk sometimes too. Right,
completely. So we need to make sure that we are investing, or suggesting all dental offices out there, investing in insurance and patient accounts, and making sure you're doing it correctly, and making sure you're breaking things down correctly, and making sure you're valuing the time of the person doing it, whether you have somebody in office or you have somebody out, doing it remotely for you. It's important, and it's not something we want our office to be driven by. Like, we don't want to diagnose just based off what insurance covers, but we better have a good idea of what the insurance is going to cover and where they're going to step up and not.
Well, and the other thing I just want to add, if there's doctors watching this, if you're in your office doesn't want to continue to educate themselves, you need someone else doing it. Because anyone who's doing insurance, you have to. I do seminars across the country, and I can't tell you, I will have a room full of people that have been doing it for 20 years, and they always come up and say, wow, I got some new things from you. Right. Because there's new things all the time, and we can't learn them all necessarily, which is why I rely on others in the industry all the time too. Right.
Yep, exactly. It's just like CE for clinical. I mean, insurance is changing all the time, so it's definitely necessary. Well, good. Well, just as a little plug for Front Office Rocks, we have Colleen doing advanced insurance training on our website. So we break down insurance, and we'll be adding new things all the time. So if you love this video, you want to hear more about Colleen, let us know, write questions below. She speaks around the country, I speak around the country, and we have videos on Front Office Rocks. So we are here to be a resource for you and your team. If you haven't subscribed yet, make sure you subscribe below so we can let you know when the new videos come out. And thanks, Colleen. I think that was a good insight to help doctors remember how important it is to focus on this in the practice.
Thanks, Laura. I think it was too.